all of these things, unequal access to care, all of these things are playing into some of these numbers. 22% of maternal deaths in Tennessee, some of this is involving a level of discrimination, um, implicit and explicit bias in healthcare. I could do an entire another presentation, a whole another presentation on discrimination, but I chose here to look at trauma-informed care. But any one of this is really really an issue when you look at the numbers here. So let's see, what are some of the other health disparities? Um, we know that infant mortality rate in the United States is 5.4 deaths per 1,000 live births, but in Tennessee, it's significantly higher, 7 per 1,000. I think uninsured, there's a lot of people uninsured in Tennessee. It The uninsured rate for working age adults has decreased to 11%, but Tennessee's uninsured rate for low-income adults is at an alarmingly high rate, 24%. Your neighbors in Kentucky is 12%. But Kentucky did expand Medicaid. So, as physicians and providers, we need to be involved in multi-level work, advocacy work too, because lack of insurance, we know it limits prenatal care. I mean, let's just say, you get self-pay patients. What is that? That's code for the hospital is absorbing that. Like self-pay, they're not gonna pay. Like they don't have the ability to pay. They don't have health insurance. If the state's not paying for it, hospitals are in a conundrum because they have to absorb those costs a lot of ways. And of course, behavioral health. Remember this statistic, this 20%. I'm going to come back to it and explain a little bit. Keep that number in your head. And just understand that, Tennessee faces a particularly high prevalence substance use disorders, especially in rural areas. And it negatively impacts maternal and infant health outcomes. Like if you don't have the health insurance, like you're not going to go to your prenatal visits. You're going to come when it's crisis time. You're going to let things linger. You're not getting your mammograms. You're not getting all of these checkups. So that's something to keep in mind as well. Some other health disparities related to rural areas, rural disparities, as you can see, low vaccination rates, insufficient primary care investment, that's systemic challenges, requires innovative, really compassionate solutions from where I'm sitting. And it just tells you, like, if you keep these things in mind as I go through this mindfulness informed care practice, the framework that I'm going to lay out, I think it really addresses and helps to buffer, helps to buffer some of these larger systemic effects. It's a little overwhelming, honestly, when you look at the whole thing. But what can you do to reduce the amount of stress? How can you promote holistic well-being?